Hi, good day everyone. My name is Mitra Suratan and I'm a third year psychiatric nursing student here at Costa. A strength of mine I believe I have as a student is I'm very disciplined. I'm curious and I'm disciplined. When it comes to my studies, I am more likely to fully understand the material that is being taught to me rather than just memorizing it for the sake of an exam. I take the time to review my notes. I ask questions whenever I'm unsure about anything, and I reflect on how well my learning applies to both my clinical setting and in real life situations. I think this makes me a more thoughtful and effective learner. I also make an effort to stay organized and I plan my time so that I can balance my classes, my assignments, personal life, and also the clinical setting as well. One weakness I think I have is that I overthink things a lot and I procrastinate, especially whenever I feel overwhelmed by multiple tasks or assignments. I can get caught up worrying about whether I'm doing something perfect, which can slow me down and make me hesitant to start an assignment or even finish one. To help with this though, I have been working on breaking tasks into smaller and more manageable steps and setting personal deadlines before the official ones. I also remind myself to focus on progress and not perfection. Over time, I've noticed that this approach has helped me feel more in control of myself and less stress, and it allows me to stay consistent with my learning. I think being aware of both your strengths and weaknesses as a student is very important because it allows you to build what you're good at while actively working on the areas that challenges you. And when it comes to epidemiology, my basic understanding is that epidemiology is a study of how health conditions and diseases affect groups of people. It looks like patterns like who is affected, where it happens, when, and why. Epidemiology helps us understand the causes, the risk factors, and the prevention strategies for health problems. It's not just about infectious diseases, it also indicates chronic illness, mental health conditions, and lifestyle related issues. So, by understanding these patterns, we can take steps to reduce these risks and improve health outcomes by both the individual and at a community level. And for nursing, especially, epidemiology is essential because it guides us to evidence based practice. It helps us decide which interventions are most effective, which patients or populations are at a higher risk, and how we can prevent illnesses through education and health promotion. My own twist on it for psychiatric nursing, specifically epidemiology, helps us understand trends in mental health conditions, substance abuse, and the suicide rate. This knowledge allows us nurses to provide care that's informed, proactive, and tailored to the real needs of the community. It also gives us data to advocate for better policies, programs, and support systems for patients and families. I would like to thank you for watching my introduction, and I look forward to working and learning with all of you and growing as we all do every semester. So thank you and take care.